less severe in an adult than it is in a child. As she mentioned, with children, a suppression crisis is a medical emergency, and I mean, the interventions have to be pretty much immediate to save their lives, because it can result in death if it's not.
They might have to get blood transfusions. They might have to get their spleen removed. It just depends on the severity.
Back to acute vaso-occlusive crisis. Just so you know, we talked about some things that can, cause those things. Stress, dehydration, alcohol as well, and that usually lasts anywhere. That can last anywhere from 3 to 14 days. That particular crisis right there. Aplastic crisis, we kind of mentioned it briefly earlier. This one is usually caused by a virus called the parvovirus. So what happens is that the hemoglobin, the hemoglobin levels drop really low because of the rapid turnover of the sickling of the red blood cells. And so you go into this aplastic crisis, but it's usually caused by this parvovirus. And have any of you heard that virus used before in other situations? Where do they generally see it come from? Dogs or pets of some sort, right? So, this is important for your patient education, as well. If someone, has sickle cell, you definitely want to let them know, about aplastic crisis that could happen because of the virus that comes from the pet. So the bone marrow, what's happening with aplastic crisis, the bone marrow is not producing the red blood cells fast enough to keep up, and so they have severe anemia. And then, and like I said, that is because the turnover of the red blood cells, the sickled red blood cells, is just happening too fast, and the bone marrow is not able to keep up with it. So it's very self-limiting. So the bone marrow, it does recover on its own in a few days, and it can be treated with transfusions. And you want to treat the symptoms that comes along with that as well. So it does only occur once. It only occurs once because the body, it builds up immunity from the virus. So you don't have to worry about it recurring over and over again. And you usually see this in kids under the age of 16, the aplastic crisis. Doesn't mean it can't happen in any age, but this is where you normally see it. And now down to the sequestration crisis. So the sequestration crisis, that's also you also may hear it referred to as the splenic sequestration crisis, because it can specifically affect the spleen and the pooling of the sickled cells in the spleen area. So you may hear it referred to as a splenic sequestration crisis, and it's the same, they're referring to the same thing. So too many sickle cells, they accumulate and they get trapped in the spleen. And so what happens is, once they get trapped in the spleen, they can't go back out into the circulation. And so what happens, the spleen, it begins to swell. It doesn't, it's not able to function correctly. And if your spleen isn't functioning correctly, what else you think might be happening, or you're at higher risk for, or your patient is at higher risk for? Infection, right? Your spleen plays a big part in your, in your immunity. So you want to make sure that, like I said, that is a medical emergency and it does require treatment. So more common in children and infants before the age of 5. It's more common. Now it can, like I said, it can affect adults, but the circulation issues of the, being able to circulate into the blood versus in children, in adults, the problem is not as serious with adults, because that blood can, it does not affect the circulating volume as much as with children. Yes?
Well, and that's what I was going to ask, because I think we already asked about this. You can live without your spleen.
Yes, you can.
So you can just remove it and you should be fine, even as a kid, right?
Some,
It's
well,
just a filter for extra.
well, but it depends. Remember with sickle cell though, they have red blood cells that aren't living as long. Their red blood cells live 10 to 20, 8 to 10 days or something like that, as opposed to 120 days. So if their red blood cells are not replenishing fast enough, and then you also have the spleen that has to be removed, that could cause death in a child. They may not be able to live without that extra push of blood and that kind of thing.
Transfuse.
So you have to transfuse and all of that stuff. So it depends on, how well they respond to all of that. So that's why it can be a medical emergency in a child. Most of us, yes, most of us that are healthy, that have normal, healthy red blood cells that live 120 days like they're supposed to, and we have enough, yes, we can live without our spleens. But a child with sickle cell disease, that can be a lot more problematic for them and a lot more deadly for them.
Alright, so treatment, we talked about IV fluids, blood transfusions, and that's just obviously to increase the intravascular volume. So we want to get the blood, we want to get that volume up because, the less volume, you have the anemia, the blood is thicker or more viscous. So you want to make sure you increase the volume of the blood. And then, as you said, you might have to have your spleen removed, but that's going to also come with other interventions like frequent blood transfusions of sorts. So, yes, you can live without your spleen, but it just depends. It is more dangerous for a child versus an adult, but still there's interventions that will be required if that happens. So circulatory collapse is what Ms. Colson was talking about earlier. That is the medical emergency that you see in children when they have that sequestration crisis. They have a circulatory collapse, so their circulatory system is just shutting down. And if that's shutting down, blood is not getting to organs or vital organs of the body, and that's what leads to death. And if it's not treated in less than 30 minutes, that could lead to death. So it has to be really fast interventions.
See, the thing about young kids is they get well really fast, but they can go downhill really fast too. So, and this happens in younger kids.
So could it be as at least just getting IV fluids within 30 minutes?
It's probably gonna be more than IV fluids with them. Blood, yeah. So getting them to the hospital as soon as possible is the important thing, so that they can get treatment, transfusions, IV fluids, whether they might have to go to surgery. Just getting them to the hospital as soon as possible. Well, it can have a negative result in as fast as a half an hour.
Yeah. So knowing the signs and symptoms, the history, that's
Like if your child has sickle cell, and then knowing, if there are problems that are occurring.
So clinical manifestations or your signs and symptoms of sickle cell, you have your fatigue and weakness, which is probably due more to the anemia, which is caused by the decreased level of red blood cells or oxygenated red blood cells flowing through the body. And like I said, with those sickle cells, they're just not being replaced. They're just dying off, but they're not being replaced because, they're dying, too quickly. You have also pain. Pain can come from the sickle cells, like clumping into the vessels, and it's causing the blood flow to decrease to the area. So bones, organs, they're not getting proper blood flow because of the clumping of the sickle cells. So that can lead to the pain. That can also lead to the swelling. Tachycardia. You got to think, if your blood is not flowing to these organs, your heart is thinking, okay, I need to pump faster so I can get the blood out. But it's truly in vain when you have these sickle red blood cells that are dying off and not being replaced, quickly enough, or they're clumping and the vessels are blocked anyway. It's just in vain. So you can get tachycardia and develop heart murmurs and things like that from your heart working overtime trying to compensate for the loss. Bone enlargement. Bone enlargement can come from anemia. So, and you can see this bone enlargement in, different joints in your extremities. You also can see enlargement of the bones in the face and in the skull area. And that also is coming from the bone marrow as well, trying to overwork, trying to replace those blood cells. So the bone marrow, being overworked can also cause swelling as well.
So the sickle red blood cell that you said it dies off in 10 to 20 days, is that for the lifespan of the person, or is that just when they're in a crisis?
Well, you see the sickle cells when they're in crisis.
Right.
Yeah.
So when they're not in a crisis, they have normal red blood cells that are reproducing.
Right.
Yeah.
You know, they may always have some sickle cells floating around, but it's not,
Not enough
usually
to
not
cause.
always, So it's when they're in crisis is when they have those short-living red blood cells,
Yeah. All right, so next we have fever. Fever can also cause crisis as well. We talked about tachycardia and murmurs, and we talked about enlarged on bones. Okay. So diagnoses. Usually they're going to do a couple blood tests are normally done. So you have a CBC. Usually they'll do that, and then they'll do a test called hemoglobin electrophoresis. Also, if it's someone who is going to need blood, they're probably going to do what they call a type and cross to make sure that they get the correct blood in case a blood transfusion is needed. Electrophoresis, the hemoglobin electrophoresis. So electrophoresis actually measures the different types of oxygen that's carrying the hemoglobin in the blood. So that's why that particular test is important, so that we can see how much of oxygenated red blood cells are circulating through the blood through the electrophoresis test.
And it can identify the type of hemoglobin. That's how they can identify the S hemoglobin with the hemoglobin electrophoresis. So that's how they can identify.
The electrophoresis also, as I mentioned earlier, it was like hundreds of types of hemoglobin. It's over 350 types of hemoglobin, so that electrophoresis can help differentiate those different ones. But of course, in sickle cell, you're looking for that hemoglobin S. Okay.
And really it's SS, because you're going to get two. But
So you have the hemoglobin S, which is the sickle cell that we talked about as well. But what if it came up and the electrophoresis picked up a hemoglobin C? So if the hemoglobin, what did I do with my pen? The hemoglobin C,
well, that's kind of hemolytic anemia.
yeah, that's what I'm saying. That's the hemolytic anemia. So that's one of the, that's another type of anemia that we see. So the hemoglobin C represents the hemolytic anemia. So that might be come up. So that's, seen in abnormal amounts of types that indicate a disease. So if you happen to see an abnormal amount of hemoglobin C, that might mean that you have a hemolytic anemia. So healthy adults, they have a significant amount of hemoglobin A. They have about 95 to 98%. So a healthy adult, someone without sickle cell disease, their hemoglobin electrophoresis should show about 95 to 98% of the hemoglobin A in that test. All right. And then infants have their hemoglobin that you mainly see in infants are called hemoglobin F. Is the type of hemoglobin that is generally seen in infants. So if electrophoresis is done on them, you would expect to see hemoglobin F. And the last thing I think that I'm going to be talking about, the second last thing. So some of the complications of sickle cell, you got anemia, which, we kind of talked about that a lot in detail earlier, of how you develop the anemia. Pulmonary hypertension, we talked about that earlier, as far as what can happen if, with lungs, if you have, your sickle cell is affecting your lung organ. Pulmonary hypertension is one of those complications that you can run into. So it's increased pressure in the pulmonary arteries is what causes pulmonary hypertension. So basically the vessels of that the pulmonary arteries, they start to thicken. So if the vessels are thicker, it's less room for the blood to flow through. And so that can lead to heart failure, actually. So the pulmonary hypertension, if the blood is not able to, flow through the pulmonary artery, which oxygenates the blood, then it can actually lead to heart failure. And I think it says specifically right-sided, but I don't know cardiac, but sometimes I don't
Specifically
think they really specify.
right-sided because the blood comes into the body through the right side of the heart, and so if the blood vessel's thick and it's not pumping out of that right ventricle is good, so it can lead to more right-sided heart failure easier. Because
I know when I was in nursing school, we really went in detail about right-sided and left-sided heart failure, but now they kind of clump them together a lot now, so I just wanted to be sure. And then, of course, it is gonna increase the cardiac workload, if the pulmonary artery isn't functioning correctly, so, it could lead, to all sorts of cardiac issues, from pulmonary hypertension. Stroke, same thing, strokes happen, y'all haven't done stroke yet, have you?
nope, that was
Okay.
tomorrow,
So,
hopefully.
when you guys get to stroke, you'll see, some of the ways that strokes are caused, and one of the ways is like through clots. So clumping of the blood cells is essentially a clot, so it could lead, to stroke. And then that acute chest syndrome that we talked about, that is also a complication of the sickle cell. And this can occur 75% of the time in a sickle cell crisis. Or they can develop what they call a pulmonary embolism, which is basically a clot in the lungs. So same concept of the clumping of the sickle cells causing a pulmonary embolism or a blood clot in the lungs. And then an infection that causes respiratory distress and even death. So that is all, things that are associated with the acute chest syndrome. So you usually see someone, if they have acute chest syndrome, they're usually running a fever. So a fever is one of the things you can expect to see. And it often develops more in children, young children. So you do see a lot of respiratory symptoms with them that may not be as developed as it will be in an adult. And then symptoms are more severe in adult for the acute chest syndrome. They're more severe in adults, so you see fever, you see cough, but you might see that more in the children, but in your adults, you see chest pain, you see fever, you see cough, but you see chest pain, you see pulmonary edema, you have difficulty breathing, and those are more the signs and symptoms you're gonna see in an adult. Oh, okay. Those are the ones you're gonna see more in an adult, and those are, more severe in your adult population. And then treatment, we have antibiotics, we have bronchodilators, we have transfusions. Is that incentive spirometry?
Mm-hmm.
Incentive spirometry. So you can also get infections from complications of sickle cell. We also can have leg ulcers. You generally see from sickle cell. If the blood flow is not flowing, to the lower extremities, you can develop, these ulcers. We also have eye damage, and that's due to the damage of the blood vessels going to the eye, and especially the retina. That's that main artery that supplies blood to the eye. So if there is, the cells are clumping there, then that can occlude the blood flow to the artery. And once that artery feeds all the other capillaries to the eye, if they're not getting any blood, those are gonna die off, and it could lead to blindness. Substance abuse is a complication of sickle cell. As you can imagine, someone with sickle cell is probably on a lot of narcotics, and very often, and it can lead to substance abuse because of the chronic pain medication use.
And some of my group kind of saw that in action last week and the week before that, because we've had a couple sickle cell patients already, and the amount of pain medicine that they require, especially when they're in crisis, is
I had,
very difficult.
I worked, I was a med surg nurse, and I came encounter with sickle cell patients a lot, and they drilled in us, in nursing, that pain is what the patient said it is. Eventually, even pain became like the fifth vital sign, is, what they, started calling it. So, I had a patient who had sickle cell, and, he could barely stand, talk, he was just, appeared to be heavily medicated, but he was still asking for pain medicine, and I found myself like in a situation like, what am I supposed to do? Because he says he's in pain, but what I'm seeing is he looks like he might possibly have too much pain medication. So I did, I spoke with the provider to kind of see, and then so we looked into some alternative pain relieving solutions to assist with the pain until it was time for him to get another dose, a safe dose of medication. So you may run into that as well. But on the flip side of that, you don't want to automatically assume someone with sickle cell is drug seeking either, because they're really in pain. So. And priapism, this is where blood fills the penis, and then it kind of gets trapped, so it causes prolonged erections. So you can also see that in someone with sickle cell. This is not a normal thing, but it's a normal complication of sickle cell. So we just want to make sure that we're aware of that. So that sickle cell can lead to impotency. Yes, ma'am.
Could you put like a heating pad on wherever it's hurting, so that it would like vasodilate, so that somebody can get some.
That is, and I don't even mean to answer for you, but we do see that being done a lot of times. They do that to help treat pain as a non-pharmacological, but we also have to be careful in doing that, using heat and cold for patients that aren't getting good blood flow to different areas, because that can cause damage. So you really have to be careful with that. I have seen them use heating things a lot. They have some of those things that they can do heat, or that you pop. I've seen them use those a lot versus heating pads that can do more damage. So you really do have to be careful with heat and cold, especially cold, because it can be cause more sickling. Yeah.
And that's what I was gonna say.
Yeah.
It's like I would be cautious.
So they probably not usually.
Because if the blood flow, just like with someone with diabetes, if the blood flow is not there, they can't feel how hot or cold it is, and it can cause complications, burns, or
And since it's a hemoglobin issue, that wouldn't help that aspect, I would assume, right?
It wouldn't help.
No, it would only help.
Just
Mainly
pain.
done for pain
Yeah,
purposes,
it's pain.
but yeah.
But then if it vasodilates, I feel like there would be less hemoglobin in that area. 'Cause it's not
Well,
concentrated.
usually you wouldn't have vast vasodilation. It's just that usually you're using heat to a particular localized area, but again, more so dangerous because of the lack of blood flow and the lack of feeling and damage or whatever. So.
All right. So our priority treatments for patients with sickle cell. We want to promote oxygen and circulation. So that is oxygen and IV fluids. That is the main treatment that we treat when they come in. You want to maintain the fluid volume, so they're going to be on continuous IV fluids if they need transfusions. That's a way to maintain fluid volume. And you want to manage the pain, of course, because a lot of your patients who come in with that vaso-occlusive crisis, they're going to be in a lot of pain. So we want to make sure that we help manage their pain, and then, of course, prevent infection. We want to prevent infection, because the infections actually make crisis worse. So we want to, prevent infections that can lead to that, even in our own hospital-acquired infections as well. So we wanna make sure you use good hygiene, hand hygiene, things like that. And that's all I got.